diabetes is a chronic disease, and the most common one, we have various types of diabetes like type 1, type 2, and gestational diabetes. And type 2 diabetes is the most common one. It's about 90 to 95% of the cases diagnosed. Yeah, I would say that type 2 diabetes is irreversible. So once you get, you'll not be able to cure it. There is no cure until this moment. So what we can do, we can only either achieve remission. Yeah, I will talk about it later. Or we try to maintain and achieve optimal control. Diabetes is characterized by excessive blood glucose level. It's either due to insulin is not enough, yeah, or insulin resistant. What does it mean? Insulin is there, but they cannot work it effectively. So in Malaysia, to be specific, 1 in 5 of Malaysian adults are having diabetes. 1 in 5, that's a lot. Yeah, and one of the contributing factors for type 2 diabetes in Malaysia is obesity. And we are the highest of obesity rate in Southeast Asia, where 1 in 2 of a Malaysian adult are either overweight and obese. And the surprising fact was that for those who has diabetes, 50% of them at point of diagnosis, they do not know that they have diabetes. Yeah? And this is especially common among those younger patients, you know, like age about 20 to 30 years old. When we talk about microbiome, I am thrilled because the fact that I know we are carrying almost 100 trillion microbial cells, which is 10 times greater than the number of cells in our body. Yeah? And if you equate to weight, it's about 2 kilos of our weight. So we have about 2 kilos of microbiome stay in our body, right? And when we talk about microbiome, the key word here is diversity.
Did you know that diversity is the key to a healthy microbiome? In a forest with only one kind of tree, what would happen if a beast came along and ate up all the leaves? All the creatures in the forest would be affected. In the same way, diversity is also needed in the bacteria of your gut. Scientists have discovered that your microbiome fingerprint actually needs to consist of many different types of bacteria to keep you strong, healthy, and resilient to drastic or harmful changes. Did you know that a healthy microbiome likes balance? When your microbiome becomes unbalanced, you may become unhealthy and even susceptible to chronic disease. But with the help of your superheroes, your microbiome always strives to return to a natural, balanced state.
That's what it means by diversity. So it means that you need a variety of microbiome, yeah, to make sure that your gut ecosystem become balanced. And every microbiome has an important role to play. In recent years, the role of the gut microbiome in health and chronic disease, including in diabetes, has emerged. Yeah? And it started when the scientists from Denmark, yeah, analyzed the fecal of people with diabetes and compare them with those without diabetes. And they found that those with chronic disease, yeah, usually has less diversity, yeah, in balanced microbiome. And this diversity is important because it's helped us for digestion, and it's also produce short-chain fatty acid, yeah, certain short-chain fatty acid like butyrate that improve our insulin regulation. That's important to maintain the glucose homeostasis. So they concluded that diversity of the diversity of gut bacteria in patients with diabetes is less diverse, and certain bacteria is important to play a functional role in maintaining good glycemic control, which is absent in people with diabetes. Probiotic, at that time back in 2015, probiotic is like in thing, it's everywhere. Yeah. So we did the study. The objective of the study is to investigate the effect of multi-strain microbial cell preparation. We use HEXBIO, yeah, because it has been shown to be safe in other populations. And this HEXBIO is also known as multi-strain probiotic for our study. And we look into the effect on glucose control and other diabetes-related outcome as a secondary measures in people with type 2 diabetes. So why we did this study? Number one, as a dietitian, we know that I'm very diet-centric, and we know that diet is considered a primary determinant of gut microbiota. And gut microbiota can possibly influence several physiological functions that are linked to type 2 diabetes. As I mentioned earlier on, that gut of people with type 2 diabetes is less diverse. And second, we also know that diet of patients with diabetes is not optimal. It's kind of obesogenic and diabetogenic. We heard about carcinogenic, and for those people with diabetes, we also know the diet is very diabetogenic. What does it mean? High in energy dense, contribute by fat, mainly saturated fat, and sugars, which is harm the microbiome ecosystem. Their fiber intake, we know the role of fiber prebiotic in maintaining our gut system is also less. If you look at into their fruits and vegetable consumption, it's far less behind than the recommendation. We do recommend fruits at least 2 servings, but people with diabetes is only take less than 1 serving. We do recommend vegetable to be 3 servings per day, and it is even less. It's only 0.8 serving per day. So in overall, patient with diabetes has very low fiber intake. They only consume about 6 grams per day versus 20 to 30 grams as per recommendation. All right. So because of that, we think perhaps if we provide patient with probiotic, they might help in some way to improve their gut ecosystem. So we design a study using a randomized, double-blind, parallel group, and we conduct this study in one of teaching hospital in Kuala Lumpur, which is HUK. We recruited about 136 patients with type 2 diabetes. Their age is about 30 to 70 years old, and we randomly assign equally to either probiotic or placebo. So those in probiotic, they consume about 2 sachets per day, whereas in placebo, they also receive similar, looks like a probiotic, but they don't have any active microbiome, active bacteria. So we assess glucose, lipid profile, their body weight, their dietary intake, their blood pressure. And we also took their fecal, because we wanted to know the amount of bacteria that successfully pass the gut. So to indicate that they really consume the bacteria. So now let's look at into the result. It's very interesting finding. So what we found, number one, in terms of primary outcome, the HbA1c, the indicator of blood glucose control, decreased by 0.14%. Whereas in those placebo group, they increased their HbA1c by 0.02. It was significant for those who really and comply to consume probiotic 2 sachets per day every day throughout the 12-week study. We also found that the insulin level improved. They become more sensitive at the end of the study. Other outcome was not different, but we confirmed that probiotics have successfully passed through the gastrointestinal tract when we look at and when we culture their fecal. So what we can conclude that in this study that was conducted, probiotic modestly have improved the A1C, the glucose control in our patient with type 2 diabetes, if they consume and adhere to the dosage and consumption. We know that diet, or our term called medical nutrition therapy, is a fundamental management in diabetes. So no matter what diabetes they are, what stage they are receiving drugs, they are on insulin, yeah, or they are just having a lifestyle modification, diet play an important role across the horizon of the disease. Okay, so when we talk about diet, patients with diabetes need to be concerned about carbohydrate intake. Yeah, in Malaysia, our patient with diabetes consume excess amount of carb, you know, and that's need to be rectified. They also need to include a right type of carbohydrate, which is higher in fiber, yeah, as well as high in a whole grain, as well as low in glycemic index, where will provide a balance and reduce your blood glucose level. Like there are fiber product, your food that high in fiber that also contain sugar, that need to be concerned. Yeah, you have to choose perhaps a home cooked prepared meal that have a real fiber from the fruits, vegetable, as well as cereal fiber like brown rice. That will help patients to improve their overall glucose control. Yeah. In my clinic, for example, a lot of patients look for additional therapy, supplement, functional food, herbs, and nutraceutical. Nonetheless, when patient asks and we wanted to provide our expert input, it must be based on safety, because patients with chronic disease, they come with variety of complications, and therefore it is important to consider the safety of the product that we wanted to recommend. And the second one is efficacy, because we don't want to waste our money buying things that won't provide any additional benefit. So this is the two important questions to us. And when it comes into probiotic, it has been known as one of the nutraceutical. And nutraceutical is food or substance that will provide additional benefit to health and disease. Yeah? And studies have shown that probiotic is one of the potential nutraceutical. Yeah? And one of the meta-analysis that recently published shows that with the use of probiotic, it provides small improvement in A1C, in blood glucose. Yeah, the drop in blood glucose in HbA1c is about 0.1 to 0.2. It's very minimum generally, but together with diet and exercise, it would help to facilitate patient journey to improve and achieve their target for diabetes control. Diabetes, any drop in A1C, would improve patient prognosis, because the effect is continuous. For example, in one of the landmark diabetes trial, they look into patients who were on trial and improve, and they stop the study. So what happened for those who really improve at the beginning of the study? They have also prevent the future complication that they might get. So in diabetes, we always believe that any improvement, even though small, will provide benefit in the future. So we encourage patients to have a small drop in A1C continuously. And we call this term as a legacy effect. So you won't get now, but your investment to improve your glucose control will translate it future in preventing the whole range of diabetes complication.